Have you ever wondered who helped deliver babies before doctors and hospitals became the norm? It's a question that takes us back to the very roots of human civilization, and the answer is as old as time itself. Midwives. Midwifery, the practice of assisting women in childbirth, has been around since time immemorial, with roots reaching back to ancient civilizations. The ancient Egyptians, for example, revered midwives and depicted them in their hieroglyphs. They understood the importance of these skilled women in ensuring the safe delivery of babies. A similar story unfolds in ancient Greece and Rome, where midwives were held in high esteem. Greek mythology even has a goddess of childbirth, Eileithyia, often depicted as a midwife herself. In Rome, midwives were seen as critical to the continuation of the family lineage and were often part of the family themselves. Now, you might be wondering why midwifery was, and in many cultures still is, traditionally a woman's profession. Well, in the past, societal norms and constraints played a significant part in shaping this. The intimate nature of childbirth was seen as a strictly female domain, a sacred space where men were generally not permitted. This allowed women to gain expertise and become the gatekeepers of this essential life process. In many ways, midwives were the first women's health specialists. They didn't just deliver babies, they provided prenatal care, postnatal support, and even family planning advice. They were the pillars of their communities, respected and trusted by all. But it wasn't just societal norms that made midwifery a woman's profession. It was also about empathy, understanding, and the shared experience of womanhood. Who better to support a woman in labor than someone who understands her fears, her pain, and her joy? So, midwifery has been around for millennia. But how has it evolved over time? That's a journey filled with resilience, adaptation, and a deep-seated commitment to women's health. But that's a story for another time. As we journey through time, we see the role of the midwife changing and adapting with society. During the Middle Ages, midwifery was a profession practiced almost exclusively by women. They were revered figures within their communities, often taking on roles as healers and counselors. Midwives were entrusted with the sacred task of bringing new life into the world, often in the comfort of the expecting mother's own home. As we moved into the Renaissance period, midwifery began to face its first significant challenges. With the advent of male-dominated medical professions, midwives were increasingly marginalized. The rise of obstetrics in the 18th century further pushed midwifery to the sidelines, with childbirth becoming a medical event that took place in hospitals rather than at home. In the 19th century, the medicalization of childbirth continued to increase. This period saw the introduction of forceps and the widespread use of anesthetics, which were often administered without the woman's consent. Despite these changes, midwives continued to play a crucial role, particularly in rural areas and among women who could not afford hospital care. The 20th century brought about a resurgence in the practice of midwifery. The natural childbirth movement of the 1960s and 70s advocated for less medical intervention and a more holistic approach to childbirth. This shift in perspective led to a renewed appreciation for the skills and wisdom of midwives. Today, midwives are recognized as essential healthcare providers, offering a range of services from prenatal care to postpartum support. In the modern era, we've seen a fascinating blend of tradition and innovation in midwifery. While the core philosophy of supporting natural childbirth remains, midwives now also have access to advanced medical technologies and training. This balance of old and new allows them to provide comprehensive, personalized care to women and their families. But the story of midwifery doesn't end there. The profession continues to evolve, adapting to the needs of modern women and the ever-changing landscape of healthcare. So, let's continue our journey and explore the philosophy and importance of midwifery today. In today's world, you might be wondering, what does a midwife do? Well, let's pull back the curtains and take a closer look. A modern midwife is a knowledgeable healthcare professional who has undergone extensive training and education. Their role is multifaceted, and they wear many hats. Midwives are medical professionals, educators, counselors, and advocates all rolled into one. They begin their journey with a degree in nursing or a related health field. After that, they embark on a rigorous midwifery program that typically lasts 2 to 3 years. This includes both theoretical learning and hands-on practical experience. It's a demanding path, but one that results in a highly skilled practitioner who can provide comprehensive prenatal care, assist in labor and delivery, and offer postnatal support. Just like obstetricians, midwives monitor the health and well-being of both mother and baby throughout pregnancy. They conduct regular checkups, perform diagnostic tests, and provide guidance on nutrition, exercise, and overall wellness. But their role doesn't stop there. Midwives are also trained to handle a variety of birthing situations, including home births, hospital deliveries, and birth center deliveries. They are skilled in facilitating natural births, but can also administer pain relief medications and perform medical procedures if necessary. And when the big day arrives, midwives are there providing not just medical support but emotional support too. They are experts at creating a calm and supportive environment, helping mothers feel empowered and confident as they bring new life into the world. But the role of a midwife extends beyond the birthing room. They also provide postnatal care, supporting new mothers as they adjust to life with a newborn. This includes breastfeeding support, health checks, and emotional support. And while midwives are highly skilled, they also have an important philosophy that sets them apart. They believe in the natural strength of women and the power of birth, and they work tirelessly to support women in having the most positive and empowering birth experience possible. Midwives believe in something quite profound. Birth is a natural process, not a medical condition. This philosophy is the cornerstone of midwifery, a belief that birth, in its essence, is about life, transition, and the incredible power of the female body. The philosophy of midwifery is woven with threads of personalization, empowerment, and natural processes. Each thread intertwines to create a tapestry of care that is as unique as the women it serves. Let's unravel these threads to better understand the midwifery philosophy. The first thread is personalized care. Midwives understand that each woman, each pregnancy, each birth is unique. There's no one-size-fits-all approach here. Instead, midwives provide care that is tailored to the individual needs, desires, and circumstances of each woman. This personalized approach extends beyond physical care. It encompasses emotional, psychological, and social aspects of a woman's experience, weaving a holistic tapestry of care that respects and honors the whole woman. Next, we have the belief in the natural process of birth. Midwives view birth not as a medical event to be managed, but as a natural process to be supported. They trust in the innate wisdom of the female body, providing guidance and support while allowing nature to take its course. This isn't about rejecting medical intervention when needed, but rather about not intervening unnecessarily, allowing birth to unfold as naturally and safely as possible. Finally, empowerment is a fundamental thread in the philosophy of midwifery. Midwives empower women to make their own decisions about their bodies, their births, their babies. They provide information, support, and guidance, but ultimately, they respect and uphold each woman's autonomy, her right to choose, her right to voice her needs and desires. In essence, the philosophy of midwifery is about trust. Trust in the natural process of birth, trust in women's ability to make decisions that are right for them, and trust in the personalized, holistic approach to care. This philosophy is at the heart of what makes midwifery unique. So, why does midwifery matter in our modern healthcare landscape? Let's think about it. Midwives are more than just healthcare professionals. They are advocates, caregivers, educators, and confidants. They provide a unique style of care that focuses on the individual, on their needs, their desires, and their dreams for their birthing experience. One of the most significant benefits of midwifery care is that it's associated with lower rates of medical intervention. Midwives are expertly trained in normal birth, and their care often results in fewer instances of labor induction, episiotomies, and instrumental births. This means less unnecessary interference and more natural, empowering birth experiences. And it's not just about fewer interventions. Midwifery care also contributes to lower rates of cesarean sections. This is important because while C-sections can be life-saving when needed, they are major surgeries with their own set of risks and longer recovery times. Midwives are skilled in supporting women to birth vaginally, even after a previous C-section, which is a significant benefit to the health of the mother and baby. But perhaps the most compelling testament to the importance of midwifery today is the high levels of patient satisfaction reported by those who choose this care model. Women often describe feeling heard, respected, and empowered by their midwives, leading to positive birth experiences that can have a lasting impact on their transition to parenthood. Moreover, midwifery recognizes the importance of choice in childbirth. It presents an alternative to the medical model of childbirth, offering women the opportunity to birth in a setting where they feel most comfortable, be it home, a birthing center, or a hospital. This diversity of options allows for a more personalized approach to childbirth. So the role of midwifery in our healthcare system today? It's essential, it's empowering, and it's ever-evolving. As we've seen, midwifery is not just a profession of the past, but a vital part of our present and future healthcare system.